We're having open and honest conversations about mental health and well-being. We should talk about it with Maira Ansari on Wave Now.
Good morning, everyone. Thanks so much for joining me for We Should Talk About It. I'm Maira Ansari with Dr. Stephen Taylor from UofL Health Peace Hospital. Hope you're doing well. First, I want to apologize. It's been a while since I've gotten back on the podcast, so I'm going to make an effort and kick it into gear and start doing these more on a regular basis. Someone called me out on it, and I'm so glad that they did because I needed that little push to get me going again. So today for Black History Month, we are talking about mental health in the Black community. And just kind of where there's gaps, because there are big gaps.
Mm-hmm.
What are we seeing with folks in the Black community as far as mental health resources and whatnot, Dr. Taylor?
Yeah, so there's a lot packed in there.
Yeah.
You know, I think issues in our Black community have not certainly just occurred in the last month. Although I would say in the last few months, things have gotten more intense just because of the
Climate we're in
that seems to foster racist behavior and activity. And I do think that that's a very big stressor on our communities of color, and I think it's one of the things that we should be spending some time thinking about. I do feel like we have good resources in our community, but I do feel like there are gaps there as well.
You know, when you deal with a community that has faced racism, discrimination, inequity, that can really impact a person's mental health well-being. All of those things play a factor.
For sure, yeah. And not to mention just self-esteem and self-image, you know. When you live, I'm just thinking about, you remember the white doll, black doll experiment that goes all the way back to the early 60s, you know, where kids were asked to pick the good doll and which one was the bad doll.
It's so funny you say that because I just saw an ABC special on that, revisiting
about
that topic.
Yeah. You know, and it's not like kids are taught this doll, you know, this color is good, this color is bad, but kids do absorb it. They absorb it from their parents, from their community, from what they hear on television, from what surrounds them. So, you know, when our leaders get out there and say, we're just talking and people can make their own decisions, that really is sort of watering down the reality of the issue, which is we're very influenced by the things that we hear and that surround us, and it has a huge impact on our kids.
So according to the Health and Human Services Office of Minority Health, Black adults in the U.S. are more likely than white adults to report persistent symptoms of emotional distress, such as sadness and feeling like everything is an effort. Can you explain that, Dr. Taylor?
Yeah, I think some of the things that we've kind of touched on are part of that. You know, the gestalt in the culture that we live in, policies that favor one group over another are going to be things that have a big impact on how a person feels about themselves and what they think their prospects are and how they feel like they can succeed in life. You know, we hear these common expressions all the time, just pick yourself up from your bootstraps and, you know.
That's hard.
Yeah, I mean, it's easy to pick yourself up from your bootstraps if you're already halfway up the ladder.
Yeah.
But it's not so easy to do if you're growing up in abject poverty or if you're growing up in a community that doesn't have the resources other communities do. Or if you're going to be prejudiced against, or if you're not going to get hired because of your skin color, even though nobody's going to say that overtly, those things do exist and they are realities that we have to deal with. Not to mention what schools are like in neighborhoods where some kids live and grow up. I mean, there's so many factors that I think create this unequal terrain that we all live on that I don't think we pay a lot of conscious attention to, but I think it certainly has an impact on how we feel and how we're going to grow up.
How important is it to meet everybody and get them the resources they need with their mental health needs? I mean, because if you've got one community that isn't getting help, I mean, it has an impact on everybody.
Right. I think we have this sort of homogenized way of looking at the world, some of us do, which is just give everybody equal resources and everything's fine. I think we've all somewhere along our life seen the cartoons that show the difference between equality and equanimity. where everybody has a box to stand on, but not everybody's the same height. So some people can see over the fence and some people can't. So that's equality, but that's not equanimity. And so what we really need to work on is developing resources that fit the needs of the communities that we're in, not just making sure everybody has kind of the same thing across the board. So I think we really have to spend a lot of our time and a lot of our attention thinking about what do our communities need, what's going to help each community, and what's going to help each group. What does each group need? Because I don't think each group is going to require exactly the same
thing.
Yeah, the same thing.
Because we're all different.
Very, absolutely.
Okay, but we all need the help in order for our community as a whole to move forward.
I think that's right. I'm kind of going back to that sort of picking yourself up by your bootstraps fantasy that we tend to live with. If anybody remembers Malcolm Gladwell's book, The Outliers, he points out, which I think rightly so, that all of the people that we sort of revere for their great innovations were helped along by a lot of people. Like Bill Gates, for example, he didn't make himself. His mom knew someone who had access to supercomputers that he could get on when he was a teenager. I mean, how many teenagers had that kind of opportunity in those days? So he's not really a self-made man in that sense. He had a lot of help. And I think that's true of all of us. We all get where we get because we have a lot of help along the way. And I think that's an important thing for us to focus on as we sort of reach out and help our communities.
So despite the needs that we know that are there, only 1 in 3 Black adults with mental illness receive treatment. Why is that? Is it resources? Is there stigma? What are the factors for that?
I think stigma is a big piece of it. I think resources are a part of it too. But I think stigma is pretty big. If you think about the way our society has treated our Black community historically, they haven't been treated very fairly and very well in the last 100 years. And that's not a long time historically. And trauma can stay within a community for at least 5 or 6 generations. And so the way the Tuskegee Airmen were treated, the way our Black community has been treated in the health world in the last 50 to 100 years is going to have a huge impact on how they feel about it now. And
there's a trust issue too.
And a trust issue can be there too, for sure. And rightly so. I mean, not that modern medicine has an agenda against any people of color or any group, but the unconscious bias is still there, and it's something we have to pay attention to and be aware of. Certain diagnoses are more likely to be used in our African American community than they are in the white community, for example. And I think that's something we have to be conscious of and aware of as clinicians in doing our work so that we're not practicing with unconscious bias. But that is beginning to shift. We're seeing that trend shift in our world. And our world is kind of small and fairly insulated from a lot of the communities. But I'm seeing the shift in there, and that's very encouraging. We have more women analysts, we have more analysts of color, we've got analysts with all kinds of backgrounds now that didn't exist before. And psychoanalytic work is beginning to think of the world very differently now than it has in the past. So I think within the healthcare industry, broadening our way of seeing our communities and being more open to the diversity that exists in our communities and taking that into account in our work will go a long way to help deal with the unconscious bias that we live with and with the trust issues, I think, that are inherent in the medical world.
Yeah, because if you think about it, if I'm sitting there talking to someone, and hopefully your therapist is doing their best to understand what's happening, but you may not understand some of the family issues or say the faith issues or whatever it may be, just for someone who has been in that position. For me, I'm Southeast Asian, so my culture is different. So having someone who can understand that is helpful, that gets both sides of it.
or certainly at least having somebody who can be open to learning about it.
Absolutely.
You
Yes,
know?
absolutely. That is huge as well.
Yeah.
All right. So when we talk about resources, I was reading also that for a lot of folks that who don't have the resources, sometimes going to an emergency room becomes their resource for a mental health issue, which is
Right.
because they don't know where else to go.
Yeah, I think that can be an issue. Certainly, there are a lot of areas that are underserved where mental health practitioners just aren't there. You know, if I think about psychoanalysts, which is kind of a very subspecialty of the therapeutic community, but there's only 5,000 psychoanalysts in the United States, so that's not a lot. You know, there aren't that many psychiatrists in the United States. The residency programs are not really growing to match the growing population. So every year we're having fewer and fewer of them because we're not keeping up with the growth in our community. So I think as our leaders talk about the need to invest in our mental health, I think our training institutions are one of the areas that need some of that resource and encouragement because they're just not growing. And that is an area that certainly needs growth.
Is it okay for me as a client, if I'm trying to find a therapist, to say, hey, how much experience do you have with dealing with people
Sure.
with color?
Yeah.
Is it all right for me to ask these questions?
Yeah, absolutely. I mean, you know, you're a consumer of mental health products, right? I mean, and the mental health provider is there to provide for you, but you're a consumer. And you wouldn't just go look at a car and say that's good enough and buy it. You're going to drive it. You're going to get in it and see if it's a good fit for you. And I always tell people who are looking for a therapist, that's the way you should choose your therapist. Set up a consultation with them, and they're interviewing you to try to get to know you, but you're also interviewing them to see if you feel like you could work with them. You know, I always tell people, you know, your first 3 or 7 visits with your therapist is you interviewing them as much as it is them interviewing you to see if it's a good fit for you. And don't be shy about saying this isn't going to work for me and finding somebody else.
Yeah, because the therapist ultimately wants you to get better.
For sure.
Yeah. I want to go back to talking about the stigma. Let's revisit that, Dr. Taylor. Where is the stigma coming from, and how do we overcome it?
Some of it's coming from history, like we sort of alluded to. You know, history is one of our teachers, and history can give us reasons to be suspicious. And I think it's important to recognize that the historical precedent that we've sort of emerged from is there. We need to be aware of it and acknowledge that our African American community was not treated very fairly 100 years ago, 50 years ago, maybe even 30 years ago. But we do live in a new time, and I think we can acknowledge and make reparations as we need to for the things that we've done, but also realize we're living in a different environment now and that we can begin to build on that and move forward through it. I think that's important, you know, as we think about that.
And how about, I'm going to try to ask this correctly, or make sense. Is it important for us to understand, like, you know what, if someone doesn't feel comfortable, if someone doesn't have the resources, like, how can I understand that better? How can I understand why it's hard? Does that make sense?
Yeah, let's think about the question a little. So
let me break that down. I think I know what I want to say, but like, how much compassion, like as a person saying, you know what, I understand why there's stigma. I understand why there's reluctancy, and I get it. I'm trying to understand it.
Right.
Well,
I think that's important. It's certainly important on the provider end, right, to be aware of, you know, they're not just refusing to come to you because they don't trust you as an individual. There's a whole culture and a whole institution that they're having to deal with and navigate through in terms of their own experience and bias. And we need to be aware that that's a thing that exists and to be sensitive to it.
That's what I'm saying. Yes.
Yeah. And to be able to talk about it. as a psychoanalyst, we're about talking. We're about talking about everything. Whatever even what it's like to come in the room, we talk about everything. And I think that there's something very important about the capacity to talk about things, because it's just talking, and that's an important aspect of what we do. But B, things that are left unsaid can be stumbling blocks and get in our way. And we can't read each other's minds. So we need to know what stands between you and me, and how can we talk our way through that.
Yeah. Okay. So are we improving on resources available for folks in the Black community? Are we getting better, or do we have a lot of work to do?
I think both things are true.
Okay.
I mean, I think we are getting better, but I think there is a lot still to do. We have a long road to travel, and a lot of work to do. And I do think that whenever we have institutions and organizations that restrict funding or do things that damage our efforts to try to build community resources, it can throw us back steps. But I do feel like ultimately we can continue to press and move forward as we're working on trying to make the world a better place for all of us to live in.
Yeah, I think as a society we are getting better about talking about mental health. We try to do it here because I want folks to know, despite the judgment that's out there, get the help that you need.
Right.
It's important for you. And,
That's right.
There is stigma out there still, but you have to do what's best for you.
That's true. And, be willing to shop around.
Yes.
Don't just take the first thing that comes along unless it's a really good fit. Keep looking, keep knocking on doors.
Yeah. And I noticed recently when I was looking for getting back into therapy, a lot of places, they post pictures, they post profiles. You can find out,
Right.
where people are from, what part of the country they grew up in, where they
Right.
went to school.
Right.
You can see their profile picture.
Yeah,
and
you
think,
can.
there's...
Resources like Psychology Today are things you can get on and see people's profiles and see the kind of work they do. And some people even put pictures of their offices so you can see what their office space is like. So there are a lot. Yeah, we live in a sort of a social media world where everybody has a presence online. So it's a little bit easier to see what your therapist might be like before you end up in their office.
Absolutely. Dr. Taylor, is there anything that else that I didn't ask you that you want folks to know regarding mental health in the Black community?
Well, I think it's evolving. It's constantly evolving. We're constantly working on it. We're constantly trying to make things better from our end as clinicians for the world that we live in. And we're not perfect, and we are going to make mistakes. And it's okay to tell us when we're wrong. And help guide us.
Yeah. As a community, if we all are doing better, our whole world ends up doing better.
That's
that's really what we want.
Right.
Okay.
Yeah.
Dr. Taylor, if folks are watching this today and thinking, okay, I need to get some help, maybe it's time I start talking to somebody, what should they do?
Yeah. Well, of course, you've got the 988. That's our instant helpline for texting or for phone calls. They can get you plugged in. Peace, University of Louisville's Peace Hospital is a resource. We have outpatient services, and they're open 24/7, so it's just a phone call away.
Absolutely. You can call Peace Hospital and say, you know what, I need some help. I need to find a therapist, someone to talk to. They can get you in the right direction.
Right.
That's a big step to do.
Yeah, it's huge.
Yeah. All right, Dr. Taylor, thank you for everything.
Yeah,
Great to
thanks
see
for
you again.
Good to see you again,
All
too.
right. I'm Myra Ansari. Hope you have a great day.